Welcome to the Global Medical Device Podcast, where today's brightest minds in the medical device industry go to get their most useful and actionable insider knowledge direct from some of the world's leading medical device experts and companies.
On this episode of the Global Medical Device Podcast, I have a chance to catch up with Isabella Schmitt. Isabella is the Director of Regulatory Affairs at Proxima CRO. And she and I chat a little bit about product feedback and complaints and adverse events and, sort of the relationship between these things, and get into some of, decision trees and processes that are important for you to consider within your company as far as soliciting and receiving feedback and what to do about it. So enjoy this episode of the Global Medical Device Podcast. Hello, and welcome to another episode of the Global Medical Device Podcast. This is your host and founder at Greenlight Guru, Jon Speer. I was looking back through topics we've talked about. We've covered a lot of things on, a lot of things regulatory, a lot of things quality, product development, and so on and so forth. And the guest joining me today is a somewhat familiar voice on the Global Medical Device Podcast. Joining me is Isabella Schmitt. Isabella is Director of Regulatory Affairs for Proxima Clinical Research. And she said, why don't we talk a little bit about product feedback and complaints? I'm like, that's a great idea. So Isabella, welcome to the Global Medical Device Podcast.
Hey, thanks for having me back again.
Absolutely. So product feedback, complaints, I guess, maybe a good place to start with folks is, high-level overview of what is product feedback, what is a complaint, and then we'll get into some of the nuances and the details here in a few moments. But maybe compare and contrast, or give, sort of a high-level overview of feedback and complaints.
Sure. All right. So I guess first thing to say is that it's not really an optional thing post-market to do. Well, definitely not optional to do complaints. Semi-optional to do feedback, although, people have differing views on that, I'd say. I don't really think it's optional. FDA has asked for feedback in audits before, meaning things that are non-complaints, but definitely need to have complaints. So the difference between the two is complaints actually have not a pretty strict definition, but there are certain aspects to complaints that a feedback would have to meet. So you would say something like identity, the labeling is wrong, you got the device wrong, quality, which is kind of a weird sort of catch-all term that can include many different things and is a little bit product specific. So if you're unsure whether a feedback is a complaint, but it feels like a complaint, it may be able to be caught in that quality. Durability, so that's usually if you receive the product damaged, it could either be the actual device is damaged or the packaging is damaged, so you receive a complaint along those lines. Reliability and effectiveness can be a little bit confusing because they seem kind of like the same thing. And so reliability is usually more over the use of the device. So the duration of use of the device hasn't been what was expected. So this is less for single use devices and more for devices that are used long term. Whereas effectiveness is a little bit more used for the single use devices because they wouldn't, kind of fall under reliability then. And then safety obviously is, injuries, deaths, adverse events of that nature. And performance, which is kind of along the lines of, effectiveness, is the device performing as you anticipated. And that's sort of the definition or the criteria for complaints per 21 CFR 820, which is FDA. Now, ISO 13485 doesn't actually include effectiveness, but it's not something that you can just say, oh, my device wasn't effective, and so I'm not going to include that as a complaint. Things like durability, reliability, usability, which is included in ISO 13485, really hint towards effectiveness. And so things like that would be caught under those. You don't really need to classify these, as, oh, it's an identity-related complaint, it's a durability-related complaint. But understanding kind of what that means is helpful when you're determining whether or not something is a complaint. Feedback that isn't a complaint would be something like they're dissatisfied with something trivial, like, oh, I don't really like the color of this device, or you sent me the wrong number of products, or we would like you in a future iteration of the device to make this, adjustment assessment that would just sort of improve the device, but isn't actually a problem. And then things like routine servicing. So if you have a product and someone sends it to you for regular servicing, that's part of what they're supposed to do. And even if you find a problem with it, as part of routine servicing, that isn't really qualified as a complaint. Now, it might be something that you need to address with some sort of problem resolution, but it is not qualified as a complaint if it's part of routine servicing.
Yeah.
And so those are kind of the main differences.
Okay. I mean, and usually, well, I mean, not necessarily always, but typically, I mean, when I get a complaint, I probably know it's a complaint.
Right.
But when you read the definition, and I'm paraphrasing upon your explanation a little bit, but if you read the definition from like FDA of what a complaint is, it's like, man, that could be just about anything. And I know a lot of companies, they seem hesitant. They seem focused on capturing the complaint, but they seem hesitant on the bigger picture of feedback. Which to me, I mean, complaints, comparing and contrasting complaints with product feedback, I kind of look at it as a Venn diagram. But complaints is completely contained within product feedback. So it is a type of product feedback, and I'll use air quotes, but it is a negative type of feedback, so to speak. Doesn't have to result in any sort of injury or death or anything of that nature, but it's generally speaking more negative. And I think sometimes when companies are confused or challenged with whether or not they need to capture product feedback, sometimes you don't know when you get that first bit of information as to whether or not it's just feedback or a complaint.
Right. Yeah. And I've seen companies that don't want to capture feedback. And it's a little bit tricky too, because again, like to your point, how do you know if it's a complaint or not if you're not capturing all the feedback, unless it's always a qualified person who's getting the feedback, which is not always the case. The feedback can come to anybody, right? And so people really need to capture this feedback so that a qualified person who can determine whether or not it is a complaint can make that assessment, whether it needs to follow, what would be your complaint handling SOP and that procedure through investigation and things like that, or if it's, product feedback that can kind of, stop there. You document it and keep it. But there's another reason that I think it's good to capture product feedback is that one, it's good for marketing purposes, right? So if people are giving you feedback, hey, we think that this feature request would be nice, or hey, we don't like the color for whatever reason, it's ugly. I don't know. If you get so much of that, then maybe you want to make a change for just marketability. But also, if you're getting a lot of feedback of the same nature, it could be hinting towards something that maybe is actually a problem. If it's, we've talked about usability before. So maybe it's a color related thing, and there are situations where colors can be indicative of things that are really important from a usability standpoint. Like if you think about EpiPen, right? The orange cap. And so if someone's complaining, maybe there hasn't been an issue, but they don't like the color of the cap being different, that could hint towards something that could then later be a complaint. And so maybe it's something that you want to address on the front end and be a little bit proactive before it becomes an issue. Or it could trend as something, hey, you've had this feedback, and then suddenly there's this complaint with maybe the color of the cap, like someone got injured, and you can say, oh, well, we've had multiple feedback that maybe it's the color is an issue here. And so you can kind of use that sort of traceability to figure out the root cause of a future complaint. And so that's another reason that I think it's good to capture the product feedback. And then product feedback doesn't always have to be negative. It could be positive. So if you capture product feedback that is positive, that's not really required for QMS purposes, right? But it is something good to have for marketability again. And so I'm always trying to look at like the bigger picture of things and less just like, hey, what am I required to do to check this box? But like what makes the most sense? And I think capturing all of that does make a lot more sense. And ISO wants you to capture product feedback, but FDA, like I said, has also asked for your feedback that is not a complaint to just make sure that you're actually capturing that. And the reason that they ask for that is to determine how are you determining whether or not something is a complaint. Because if you're not capturing all the feedback, you might be ignoring things that are actually complaints. And then that's where you can run into a little bit of trouble with FDA if you're ignoring things that are a complaint. And people get warning letters and 483s for things like that. So I would err on, hey, capture all feedback and make sure that your people are adequately trained to capture all negative feedback, because it could really come to anyone and you can't just ignore it. But, it should be pretty intuitive what negative feedback is, but just make sure that everybody knows they're supposed to capture that. And then anything that's a death or a serious injury should be reported to the qualified people to determine that that's a complaint. So meaning quality, regulatory, or a complaint team ASAP, because you might need to do a medical device report, which is something that you have to report to FDA in a pretty rapid time frame.
Wow, that's a lot. So,
yeah, I didn't know when to stop. I was like, when do I keep going? Should I explain what a 483 is?
We'll get to some of that, I think, in a little bit more depth here in a moment. But I think the key thing that from all of that is, for those of you listening, you may say, do I really need to capture every single piece of product feedback that I get? I mean, the short answer is, yeah, you need to log it. And in my opinion, and I think Isabella would agree, at the very least, someone needs to make a determination, is this a complaint or not? If it's not a complaint, then, maybe you don't need to take it further from a regulatory investigation per se. But, hear what Isabella is suggesting. There might be some valuable insights that you gather from this feedback that, you may want to feed to your marketing team, or maybe, it does lead to some sort of enhancement or improvement in your product. I mean, maybe, there is something important to glean from that. So I think it really is important. Now, keep in mind too, though, that, generally speaking, especially like FDA, I mean, they're, I'll say, hyper-focused at times on the complaint situation, because, remember that more or less FDA's role, CDRH's role from a medical device perspective here in the United States is to protect and promote the health of U.S. citizens. So, if they're learning about, or if there are complaints where people are getting potentially injured, I mean, that's going to be a big deal in the eyes of regulatory. So maybe elaborate a little bit on sort of that special use case still. So let's dissect that Venn diagram. Product feedback. Within product feedback, there's complaints. Within complaints, there are adverse events. So speak a little bit about what those are and why that's important for companies to be hyper vigilant about.
Sure. So adverse events are the things that you would report in what's called a medical device report. It's a form that you would submit to FDA, and there are certain criteria that you have to answer for that form, usually things that you would capture in your complaint form. What device was it? Who was using the device? What happened? And what happened has to be a little bit more detailed than it didn't work. It has to be, specifically how didn't it work? What ultimately caused whatever adverse event there is. And so an adverse event is something like an injury or a death. For medical device reports, it has to be a serious injury or a death. And it has to be that your device may have caused or contributed to this serious injury or death. So you're not agreeing definitively that your device did cause a serious injury or death, but that it may have caused or contributed towards a serious injury or death. And so when that occurs, you need to file this form with FDA. If it is a death, you need to file the form within 5 days to FDA. If it's a serious injury, you have 30 days to file this form. And then subsequent to that, you usually need to do the same thing that you would do with most complaints is, if not all complaints, is do an investigation into the root cause and determine whether or not you need to do a CAPA to make a change to the product, and or whatever the situation may be that we find out in the root cause to address this, and then you need to report that back to the FDA as well.
Well, and I guess we're sort of kind of walking people through a mini decision tree of sorts. So I get feedback. I have to determine, okay, is this a complaint? Yes or no. Complaint, is this an adverse event? Yes or no. So, and I've been in plenty of audits where, the auditor or the FDA and investigator, they wanted to know more than just, is this a complaint or not? They wanted me to justify to them why it was not an adverse event. So I think it's really important when people are assessing this feedback they're getting, that they're documenting their rationale and their decision as to why they decided what they did, And so, and I think another key point with respect to the adverse event side of things is, the time is ticking, and the time is ticking from the moment that you find out. So can you maybe elaborate a little bit on that?
Sure. The FDA uses the term, I think, become aware. And so when you become aware, it's when any of your employees, so it doesn't have to be, the QA person or the regulatory person. It's when any person from the sponsor company becomes aware of a reportable event. So the events, that we discussed, one that caused or contributed to a serious injury or death. And so after you become aware of that, you have 30 days, as I mentioned, for anything that isn't a death. But for deaths, it needs to be reported within 5 work days. And there are also special situations where FDA can require a shorter time frame as well. They can request that, and it may be for something. Maybe you've had a reportable event already. That this device may have caused or contributed to a serious injury, so not a death. And FDA, was alarmed by that and said, should you find any more of these events, please report it to us, within a shorter time frame, which is usually that 5 days again. And so that may be a situation where they can request you to submit it a bit sooner. And really, as Jon mentioned, the clock starts ticking as soon as anyone, quote unquote, becomes aware. So anybody at the manufacturer or sponsor company finds out that this event occurred. And so you could find out, a user facility could submit a form to the manufacturer company. So the user facilities often report these because they're the ones using the device to the manufacturer, but they can also report it to the FDA voluntarily. And so there is a bit of a responsibility for the manufacturer to check over the MAUDE and MedSun databases, which are the databases for reporting these events, to make sure that none of these sort of events have occurred that wasn't directly reported to the manufacturer. And so if you do see on the MAUDE or MedSun database that something has occurred, then you have then become aware of that event. And you can't just ignore it and not check those databases, because ultimately, if you've had a death or serious injury caused by your event, that's something that you'll need to address. Otherwise, it can come back and bite you in the future in the form of a warning letter. Or worse, I guess they could tell you to pause distribution, or a recall could occur. So you want to know these things as soon as they occur.
Folks, I want to remind you I'm talking with Isabella Schmitt. Isabella is the Director of Regulatory Affairs for Proxima Clinical Research. I highly encourage you to learn more about Proxima Clinical Research by visiting proximacro.com, and that's proximacro.com. Proxima helps companies with regulatory consulting, quality management system, regulatory strategy, clinical trials related services. So, a really great firm that you definitely want to have in your corner, has a ton of expertise, not only with quality and regulatory and that sort of thing, but knowledgeable about global regulatory matters. So not just FDA, EU MDR. They're really helpful and a great resource. So again, go to proximacro.com to learn more. While we're talking about product feedback and complaints, let me remind you too that Greenlight Guru, we're here to help. Greenlight Guru, we have workflows to help you document that product feedback and log those complaints and adverse events and conduct a proper investigation. So if you'd like to learn more about how the Greenlight Guru workflows can assist you with your product feedback and complaint workflows, well then go to www.greenlight.guru to learn more. So Isabella, I mean, I don't really want to scare people, but it is important, and you talked a little bit about, this is something you have to be proactive about. And, a lot of times I think, unfortunately, the way companies typically approach product feedback and complaints is they sort of, sit back and wait for it to happen. They're sort of reacting after the fact. So do you have any suggestions or tips and pointers? I mean, you talked about, companies should be going to MAUDE and other databases to on a more proactive nature, but any other tips and pointers for companies rather than just sitting back and waiting for something?
Yeah, you can do other methods of direct feedback as well. So you can send out customer surveys. Now, as everybody knows, the response rate to customer surveys is usually pretty low unless people are super thrilled or disappointed. And so you probably would receive some complaints maybe if you sent out customer surveys, because they'll likely want to fuss if they haven't already. So you can do things like that, obviously. And then there are other places that you can look for information that are indirect as well. So like social media, in the drug world, they're actually pretty much required to do these things as well. And so you can check social media, forums, things like that to see if people are making any, fuss in those places. And so you just be proactive on the web. It's really easy to check these things. And then obviously if anybody sees it, document that feedback. And then, this is, I guess, something coming to someone, but, when we were still going to trade shows before COVID, people can sometimes, come up to companies and, just the people who are at the booth, and make a complaint or some form of feedback to them at that booth. And if it is negative, it should really be documented on the spot there as well. And so that's a little bit of it coming to them, but it is not always taken as something that people pay attention to. That type of feedback, that sort of offhand, oral feedback at trade shows, rather than some sort of documented email or written letter or something like that. And so it's important to just make sure that people are aware that any feedback that comes to them is feedback. And if it's negative, it should definitely be reported so that someone with the appropriate training can determine whether or not that's a complaint, and thereby determine whether or not that's a reportable event if it is, again, a death or a serious injury.
Yeah, I'll chime in there for a moment too. That last little bit, you've mentioned variants of that a couple times in our conversation today, and I think it's worth highlighting this a little bit more. I mean, folks realize that, and this is sort of an internal training challenge, I think, within your companies. Like trade shows. A lot of times people who are at trade shows, they may be getting feedback, whether or not it's a complaint or not. It's not probably their area of domain to make that determination. So they need to log all that feedback and make sure that the right people within the company get that feedback, so that if it's a complaint or whatever the case may be, that the appropriate investigation is being conducted. Another area of challenge for companies is some products, there might be a sales engineer or somebody who's at point of use or present during the procedure and things like that. Those are often other opportunities or situations where there's this product feedback coming to the person, and sometimes it may not even be stated, right? Like the field rep may see or observe something that wasn't commented about or that sort of thing. Well, those are important things to capture too. But just make sure you're training your all of your staff to know, like, the phone rings if they get a piece of mail, if they're at a trade show, if they're in a procedure, that those are all situations where product feedback and potentially complaints could be received, and they have to know what to do with those if and when that comes up.
Right. And that goes into, again, like the, management buy-in of, quality efforts in general, because ultimately this is a management, decision who gets trained. And really, you can't train too many people on this, right? Because anybody that is a part of the company could receive this feedback. And if it is an MDR, anybody receives it, you've become aware, and then your time clock starts ticking. And so you want to make sure that everybody is trained enough to know that when they receive some form of feedback, that they should really be giving it to the appropriate folks to determine whether or not it is a complaint.
Okay.
And so can't highlight that enough.
Yeah, for sure. So, all right. So, we get the feedback, whether, hopefully we're being proactive. We determine it's a complaint. I mean, there's certain things that are expected of me at this point in time too, regardless if it's the adverse event variety or the quote normal complaint variety. What should I be doing to document what's next?
Usually, what will happen is there's a complaint form, and like I said, it'll look pretty similar in a lot of ways to the medical device reporting form that FDA actually has on their website. But you'll capture information like who's reporting this, what product is it, lot number, batch number, things like that, so that you can identify the device, and then what specifically occurred. And then I say specifically too, because like I said earlier, you can't just have this very general statement of like, oh, it doesn't work, or oh, it sucks. It needs to be more specific than that. So when you're getting the feedback from whoever is reporting it to you, you want to make sure that you get as much information from them as possible. Then after you have that information, what you'll want to do is likely conduct an investigation. And your investigation, you'll have a plan that you start working out to figure out what was the root cause of this complaint. So what happened, what failed, what malfunctioned, and determine then whether or not you need to make a change to some element of the device to fix that. In order to do this in many cases, especially if there's a malfunction, you'll probably try to get the product sent back to you. And sometimes it is sent back and sometimes it isn't. And so that's one of the challenges sometimes with investigations, is that the user facility isn't really sending you the product back. And so it becomes challenging to conduct your investigation. And you want to make sure that if that happens and you can't really fulfill the obligations of your investigation plan, that you document that as well, that's why the investigation wasn't completed, or that's why a root cause wasn't found. And so you just make sure, as usual, documentation. And then one thing I forgot to touch upon was, usually when you have these complaints coming in, we're talking about, qualified personnel. I keep saying that. It's usually people are trained or dedicated towards, addressing complaints. So you may have someone who coordinates the complaints on your team, so you may have a group of people who are designated as a complaint team. And so for the life of that complaint, they will follow through with the investigation. They may have periodic meetings to determine, where we are with this investigation, with the complaint. And so you want, again, have people who are trained in the area of complaints, and they may need to pull in people from other departments to do some of this investigation work. For example, if there's a malfunction, you may need to pull in someone from engineering to really execute on that investigation. And so you'll likely get a team of people together to address any specific areas that need to be addressed in order to figure out exactly what happened.
Wow, this is a lot of valuable information as far as what to do. The other thing that I think is really important is to analyze potential trends as well. You may get a complaint or a piece of feedback. We'll just keep it general right now. But you might get a piece of feedback, and if it's the first time you heard that, then determine what sort of investigation you need to do for that particular bit of feedback. But if this becomes sort of a recurring theme, a trend of sorts, this might be a bigger picture issue. You might need to do a more in-depth investigation. Maybe you need to issue a CAPA, because this is identifying some sort of systemic issue. But I think the key thing, regardless, is to be very methodical about this. It really is a decision tree. There are points in time through this when you get the feedback. Is it just feedback? Is it a complaint? Okay, if it's a complaint, was someone injured? Did they have the potential to get injured? Okay, is it an adverse event? And you go down this path, but I think that's just really important for people to appreciate the process. The other tip that I would offer is the person who is receiving that initial bit of feedback. That is the best time to get as much information as you possibly can. I know personally, I recall a couple of cases where the feedback came in through another channel. It was handed to me. I needed to make a determination on whether or not this was a complaint or even an adverse event. And I started asking questions like, well, what about this? What about this? And the person giving me this information, they didn't know. They didn't ask that on the initial query that came in. And, now I had to go try to track this person down who called us, and I never got a hold of them. So any suggestions on what people can do in those scenarios?
Yeah, so there's a method for determining the root cause. And so this is something that people would probably do maybe as part of an investigation, but it's something that people can do on the front end when they're gathering that information. And it's called the 5 Ws, which is pretty obvious: the who, what, where, when, why. And so when people are receiving feedback, if they can ask those questions to get a full picture of the story of what happened, I think that will facilitate in the investigation in the later stages. And then usually if you don't have enough information, you try to reach out to this individual who reported it again. So you really need, information on the individual reporting as well, contact information, who they are, so that when you're investigating this complaint, you can reach out. Usually you don't want to just reach out once and be like, oh, I reached out and I'm done. You want to reach out multiple times. Usually, as with everything, the magic number is 3. And so you reach out at least 3 times, but obviously not like 3 times in one day, within reason. Don't call them during their lunch break 3 times in a row, and say that you've done your part. You want to reach out at intervals. And then sometimes, for really significant complaints and medical device reporting events, when you reached out to them and you can't get in touch with them, you may want to send something like a certified letter to them, just to show that you've done your due diligence and trying to figure out as much information as possible on the event that occurred. But that's the way, I guess, in sum of gaining some of that information from the reporter. 5 W's, and then you may be able to add in an H, how in there, and then reach out, make sure that that you have the information of the person reporting and that you can reach out to them subsequent to that.
All right, so folks, again, person receiving this feedback, remember the 5 W's: who, what, when, where, why. Maybe throw in the how if you can get that. But my tip to you is you cannot get enough information on that initial conversation on the feedback that you're receiving. So get as much as you possibly can. It'll help everyone involved at your company who evaluates and determines whether or not something needs to be investigated further. It's going to help them immensely to have all of that information. So just make that part of your standard practice. And again, to reiterate something we talked about already, this is a training activity within your company. Make sure that people who are going to be going to trade shows or answering the phone or what have you, they understand, get this information. Probably should be in a procedure. Certainly should be something that you're showing, effectiveness of your training. So these are all very important things. And certainly if you need some help defining your processes and your procedures and best practices around this, I would encourage you to reach out to Isabella Schmitt and the Proxima CRO team. They have a lot of expertise in this area. So I would encourage you to give them a call, fill out their contact form on their website, proximacro.com. Isabella, this has been very insightful. So thank you so much for spending some time to chat with me about product feedback and complaints.
Of course. I enjoyed it as usual. It's been a while.
It has been a while. So folks, thank you so much for continuing to be loyal listeners of the Global Medical Device Podcast. It's because of you that the Global Medical Device Podcast remains the #1 podcast in the medical device industry. So, we're pumping out fresh new episodes, at least every week, sometimes a little bit more frequently than that. So, we're marching towards 200 episodes. I'll have to figure out when that's going to be, but probably the early part of 2021 will be passing the 200 episode mark. So thank you all so much for continuing to spread the word about the Global Medical Device Podcast. As always, this is your host and founder at Greenlight Guru, Jon Speer, and you have been listening to the Global Medical Device Podcast.